Hey everybody, I'm Cecily Kellogg. I blog for the Philly Moms blog branch of the Silicon Valley Moms, and I also blog at my own site, which is uppercasewoman.com. And we're talking today about healthcare reform. I am strongly in the pro-reform category, although frankly I don't think the current plan goes far enough because I would rather see us have socialized medicine completely. Pink hair, commie, that's me. But I just wanted to share a little bit about my personal experiences with healthcare. As a child, I grew up in Albuquerque, New Mexico, very poor and uninsured. And I was a sick kid. I was an asthmatic kid who had a lot of lung infections and ear infections. And each time I got sick, it was terrifying for my mother because it meant not only that I was sick, which was hard enough, as I've learned with dealing with my own sick daughter, but it was hard to cope with the scary medical bills that were coming. And when I broke my arm in 7th grade, she ended up having to pay the bill twice because she was a 27-year-old woman that was poor, and the hospital said she owed the money, so she paid for it twice, even though because it was awful. And still to this day, the shadows of this remain in my life, where I am not great about doing preventative care because I am so used to the idea that you wait till the last minute to see the doctor that you just, hold out and it'll be better and maybe this time you won't have to go. But today, I am very careful about making sure that I have health insurance and that my daughter has health insurance. I don't want her to ever feel fear or shame or scared, frightened feelings about being sick and not being able to have her needs taken care of. So as a result, my family, my husband and I are both self-employed. My family pays over $1,000 a month to have the coverage we have for the three of us. And it's a very frustrating thing because, it's more than our mortgage. It's the most expensive bill that we have every month, and it's the idea of not having it is terrifying. But I was really hoping, and I'm still hoping, that they don't drop the public option, because that would make a real, honest-to-God difference in our lives. That would make our lives better. We would be people that would be able to pay a lot less a month for our health insurance. And yeah, I'm sorry if that's selfish, but honestly, I could put money in savings. We could do work on our house and hire, contractors, and basically do our little part to contribute to the economy if we had a little more money. But it doesn't look like that's going to happen now. I don't know. But I think that it's so easy when you see the town hall meetings to think about people who are afraid that they're going to lose their doctors or lose their health insurance, and just gloss over all of those scared little girls that don't want to tell their mommies that they're sick because their moms get that look on their face that means they have another bill that they're not going to be able to pay. And that shouldn't happen, not in a civilized society. So I hope my story has an impact on you, and I hope to hear some from both sides of this issue and see what people have to say. So stay tuned to the Silicon Valley Moms, and I think you'll see some interesting viewpoints. And I think I'll sign off now. Have a great day.